Asia. I'm a senior nursing student at HPU, and I expect to graduate May 2023.
What inspired you to pursue nursing?
When I was growing up, my mom went through nursing school starting when I was 7 or 8. And I remember I used to go to lectures with her sometimes and watching her go through the process and then get her graduate degree. As I became an adult, I thought that I might want to do that as well.
What did she do at the time and what does she do now?
Okay, so her first specialty was in the OR. She was a circulating nurse. She still works as that sometimes, per diem. But now she's a nurse practitioner and she works in regenerative medicine, specifically shoulders and knees.
So you would say that your mom's presence in the medical field definitely influenced you pursuing that?
Yeah, for sure. And also, our lives changed a lot when she became a nurse because we had steady income and she only worked 3 days a week.
So now that you're actively pursuing nursing, is there anything that you wish you knew in hindsight?
I wish in the beginning I was more prepped for how difficult it can be to have emotional boundaries from like patients' troubles and hardships, and how in some aspects you kind of have to turn yourself off to be able to care for them properly and not get wrapped up or emotionally exhausted from all of their stuff in their life, and instead be sympathetic instead of empathetic, because at first I was coming home very tired and distraught.
Can you briefly explain the clinical process and how it has impacted your education?
I felt like I didn't know anything about nursing until I got into the clinical setting. Taking what you learn from lecture and applying it to real interpersonal interactions with a real patient is a lot different, and it takes so many more nuances while also remembering all of the scientific information that you've learned.
So now that you have your own patients, have you had any that have had a lasting impact on you?
Yeah, I think my first patient ever, she was an older lady, and I thought I was going to go in and do all the things that I had set out to do that day, but it actually transpired to be more of a comfort care hospice situation. So I'm providing dignity and spiritual and emotional help and care while someone transitions into death was not what I was expecting on my first day, but I'm grateful for the experience because it shifted my mindset a lot.
Alright, so if you had to advise your freshman self and give her advice, what would it be?
Probably honestly to just take a deep breath, and you feel really out of your depth at first, but everybody started out that way and you can't know everything, and like I said, the transition from lecture to clinicals and actually interacting with patients is so different that it comes with time, and just remember all the things about you that make you good with people, because most nurses have to be good with people. And that's the most important thing.
Have you had any sort of work opportunities while being at HPU?
Being in nursing school, once you do your fundamentals of nursing class, you are qualified to work as a nurse aide in a hospital.
Okay.
So that's an opportunity that's available, as well as a tech, like an ER tech, but also preceptorship stuff,
Right.
where you can work one-on-one with a nurse your senior year. That's a really good future work opportunity.
And you recently got that opportunity, right?
Yeah, OB at Tripler.
Awesome, congratulations.
Thank you. Yeah, so starting January, I'll be one-on-one with an OB nurse, learning how to help deliver babies.
Well, thank you so much, Asia. I appreciate it.
Thanks for having me.